But given that adjustment is one of the tools that chiropractors typically use, what can you tell us about, what a typical chiropractic adjustment looks and feels like? What are you manipulating? Are you simply trying to get the spine to move in a certain position, or to maybe alleviate the pressing of a nerve? What can you tell us about chiropractic adjustments?
And honestly, that's a very broad question, because there's a multitude of ways in which different chiropractors adjust the vertebrae of the spine.
Mm-hmm.
There's different ways. And so you may go to a chiropractor, someone on here may be a chiropractic patient, and they may go someone and they do it a certain way, or they may use their hands. And then they may go to someone else, may be going to a chiropractor, and they use maybe a mechanical apparatus, or they use what we call a drop table, or whatever. There's different ways of adjusting, but the concept is to get the vertebrae to move in the proper direction. So we look for a couple different things. Like I said before, we look for abnormal motion, which typically presents as the lack of motion. So something's not moving as much as it should or correctly. And then we try to get that to move better. The other thing is the direction. In other words, it could be misaligned. And so we're trying to get it back to a better state of alignment. And we do that through the chiropractic adjustment. And it's amazing. I've had so many patients over the years that would come in and they say, I've been going to chiropractors for years and I've never had one do that before. Because I was like, well, what kind of chiropractor did you see? And they said, well, they used this or they did that. And I was like, oh, that's a different technique. Just like there's different techniques to doing all kinds of things in this world. If you go to a baseball coach and they teach you how to throw a baseball, one coach may say, well, you need to do this, this, and this. Another coach say, well, you do it this way. Not that one is right or wrong, it's just there's different techniques. And so I typically use my hands. I'm a what we call a manual adjuster. I use my hands to try to find those areas of abnormal motion and try to introduce that with a light, quick impulse into that area of the spine.
Very well said. Thank you for that. One thing you said earlier was that 99% of the patients you see, they tend to come to you for pain. In light of the world we live in, where simply going to your local CVS and getting a bottle of Tylenol and Motrin, is often the primary go-to for a lot of people. What do you see with those patients that come to you for pain? What makes them come to you as opposed to just buying over-the-counter painkillers and pain medicines and using them?
Well, sadly, and I say sadly for me because I'm biased. I'm a chiropractor, so I think everyone should come to me first. But sadly, it's usually because they've tried about everything else, and not always. They'll say, "Well, I've done this, I've done that, I've tried this, and I'm still having this nagging pain. This is still going on." And oftentimes, most of our patients are referrals by word of mouth. They say, oh, my cousin came to see you and you helped him, so I thought, hey, I'll try it too. Not even knowing what we do sometimes. So I look at it as it's sad that we're sometimes often the last resort, not always, but so that's why people come to us, because maybe they've already tried those things and they're just not getting either any relief or maybe just partial relief, and it still comes on. So that's probably most of the people that come to us. We do have the occasion where people, and the information is amazing now, it's so available to us, they're like, hey, I read some stuff on the internet and exactly what I read was exactly what I had, and they say that the chiropractor can help that, so I thought I'll try. And so information also brings people to us, but most of the time it's because they've tried other things and it's just not giving them what they want. So not that we always give them what they want either, because we know there's all kinds of things that go on with people, but I tell people almost every day, I'm not going to guarantee your pain will be better, but I can almost guarantee you'll be functioning better once we get through your care plan. You still can be having some pain, but the function of your body is going to be better. It's almost inevitable. It's not because of me. It's because of what chiropractic can do for people.
Amen. Very well said. So it seems that many of your clients come to you as a last resort, as you mentioned. How do we change that narrative? How do we get people to begin to look at chiropractic medicine as a preventative approach to pain and neck adjustments and everything? How do we get that to become a mainstream, if you will?
You know, it's all about education. It's just like, you know, you mentioned about trying to just be healthier people. People just don't know sometimes how to eat correctly or whatever, how to have proper nutrition to help me be healthier. Oftentimes people just don't know what type of exercise should I do to be healthier. It's just, sometimes it's just purely lack of education. And so we see that all the time. People don't know. And another thing that's sad about that, and I say this quite often, it's sad, but it's because oftentimes we as chiropractors have not done our job well. What I mean by that is we haven't educated our patients to why they come to see us. We're, you know, oftentimes we get very busy and we're trying to work with patients and we're not saying, hey, this is why you're here to see me. It's not to get out of the pain. It's to have better function. And the side effect of better function in most cases is your pain is better. Your pain is decreased. And so we have to educate people. We have to, things just like we're doing this evening, where people may be on here this evening or will hear this in the future, have never heard this before. Chiropractic's been in existence since about 1895. And so, and we're still only seeing about 7 to 10% of the population. So 150 years of doing chiropractic with amazing results and people getting better and living healthier lives, and still only seeing 7 to 10% of the population. That's an education, and that's on us as well as our mainstream medicine incorporating that and say, hey, look, these guys can help you just like PTs or just like acupuncture or just like massage therapy or whatever. You can get better by using this. It's really about education.
Well, thank you for clarifying that. So in terms of educating patients, in terms of educating people, what sort of services do you offer? You know, what sort of things would you like the people who watch this to know that, hey, you know, chiropractors can help you with? Off the top of my head, I know sciatica. I know you guys are great for sciatica. But what else can you attest to as being, you know, something that you practice, something that you help people and patients with?
Right. Well, you know, you have the big three: neck pain, back pain, and low back pain. That's the big three, we call them. And we hate to, you know, most of us as chiropractors hate to talk about it because that's what everybody hears is the big three. But there's so many different things. One of the things that's very challenging for, I think, anyone in the medical field are people who have chronic headaches. Headaches are so complex, and it's difficult to deal with headache patients who have significant headaches on a chronic basis. We work with patients all the time with headaches with good results. You know, obviously with radiating or pain like in the arm or their leg, like you said, the sciatica and things like that, relieving that pressure off the spine to hopefully help that disc to be healthier that might be compressing those nerves. Other things, you know, we deal with. I'm actually very passionate about the athletic field. And so I've dealt with a lot of athletes over the year. And so we look at, I love athletes because they want to be better. They don't care what they have to do. They want to be better at what they do. And so we see a lot of athletes, especially when I was in Alabama, saw lots of athletes who just wanted to perform better. They didn't come in for pain. They're like, hey, I want my body to move better than it was. And I know you guys help me with that. So we used to do a lot with that. Also, I really enjoy working with children. I did that a lot back in Alabama as well. Small children, because you think about it, oftentimes the first spinal problem people have is during the birth process. The birth process can be fairly traumatic. Okay. I've never given birth, but I know if you ask most women that have given birth, they will say, yes, it is traumatic. Well, think about that small infant, how traumatic it could be. And so a lot of times we see neck issues with even infants, and obviously we don't adjust infants the same way we would an adult, but I've done a lot of training in the past with dealing with infants and children, and even with pregnant moms and stuff through that whole process. So we deal with a lot of times with females through pregnancy and small children who may have ear aches or sinus problems or chronic reflux and things of that nature, because Oftentimes it's a nervous system issue, an irritation on nerves, not necessarily a GI issue sometimes with like reflux or whatever. So we deal with that as well. And so there's really endless things. We used to see kids sometimes with bedwetting, even females who had issues becoming pregnant. Oftentimes that's a pelvic issue. And so not necessarily an issue with their reproductive organs. And so there's lots and lots of things that we see people for, but primarily, it's the big three: the neck pain, the back pain, the low back pain, and the headaches are the primary things we see. But, carpal tunnel syndrome, all kinds of things that we see people and we can help them with. And that's what we deal with pretty much on a daily basis.
Well, thank you. I want to get your thoughts on this. You mentioned neck pain, back pain, and lower back pain. What's the relationship to obesity or carrying excess weight to those things? What impact or influence does it have in terms of contributing to those areas of chiropractic medicine?
Well, it's a huge impact. I mentioned early on about alleviating interference or stressors. And obviously, when we're carrying more weight than we should, that's a huge stressor on our body. And the spine is hugely impacted. And, we see now, I don't know the percentage, but it's over 50% of the American population is considered overweight at least. And so there's a huge impact on how we carry weight. And it differs from person to person, females and males, how we carry weight on the body, how it stresses different parts of the body. We typically see with males more low back issues related to excess weight. With females, oftentimes it's neck and upper back, just because of how our fat is distributed on the body with different genders. And so it makes a huge impact, and not to mention just the overall health impact of how it affects back into the nervous system, to the brain, changing the biochemistry of the body, which also feeds back to the nervous system, to the organs. And so it's actually what we call a positive feedback system. In other words, it feeds upon itself in a negative manner. It makes you more and more unhealthy because it keeps putting more and more negative stress on the system. And so, obesity or being overweight plays a huge role. And if people do what it takes to get that excess weight off, it takes a huge amount of stress off their spine. And it makes my job way easier, because then we're not fighting another external factor. We say, okay, we've got that under control. Now we can deal better with these other things, because if I'm trying to heal and I keep getting that stress on it and on it and on it, it's hard to heal.
Well, thank you. And since we're on the topic of obesity, I figured I'd ask you, what's in your opinion, what's the importance of the role of proper nutrition in any patient that may come to you? Does it, we often don't think that, eating a certain way can contribute to your chiropractic care, but in your opinion, what's the relationship between the two?
Well, I also have a background in exercise science. I have a master's degree in exercise science. So a lot of nutritional and training and conditioning things I've got some background in. And so that stuff I'm very passionate about as well. That's why I used to love working with athletes. But nutrition is key. And I'll tell you why. I'll give you one reason why it makes a huge impact with chiropractic patients. And it's about inflammation. Because how we eat can either be pro-inflammatory or anti-inflammatory. And there's obviously many, many factors in there, but that's one of the factors. If we eat what I consider to be a pro-inflammatory diet, or live a pro-inflammatory lifestyle, it's not just nutrition, it's other aspects of it, then it makes my job even as difficult as well. Because if I'm continually increasing the inflammation in my body by how I eat or the nutrition I'm involved with, then your body's just going to sit in that state of what we call chronic inflammation. And it's a pandemic as well. Chronic inflammation is a huge problem in our society, especially Western societies, and it's dictated primarily by the way we eat. So it plays a big role in how fast people recover, or how far they recover. If they can do things, eating properly not only makes you lose weight, but reduces inflammation. I actually just did a seminar just recently on how inflammation impacts not just how we feel, but how our brain functions. And it's pretty amazing.